Well, the head of the International Policing Agency, Interpol, has told Euronews that criminals are trying to exploit the pandemic. Interpol says there's been a surge in counterfeit medical goods. In response, the agency is warning police forces about emerging crimes such as fraud, cybercrime and intimidation. Well, Secretary-General Jürgen Stock explained the trends authorities should be out on the look for.
The virus, if I may say, has sparked new crime trends. So new counterfeited medical items were seized, thousands of items, for instance, thousands of counterfeited substandards, protective masks, corona, so-called corona spray, corona medicine, and substandard hand sanitizers, just to mention a few examples. So we see already that organized crime groups are adapting. We see fraudulent sales of COVID-19 related medical equipment, counterfeited medicine, fake coronavirus tests, and so on. We see.
So if organized crime groups are adapting, are police forces, again in Europe, able to adapt as fast as these organized crime groups who are exploiting this situation?
I think they are adapting, again, with the support of Interpol, using the platform for a fast international exchange on these new trends, so that we inform each other, that we benefit from each other's experience. And in terms of cybercrime, of course, the criminals are using, for instance, criminal call centers that already exist all around the world. And they are adapting now. They are changing their modus operandi. They are trying to take benefit from the current crisis situation. And of course,
what
police
exactly are they doing? Because we've been hearing the police are well equipped, but what are these criminals doing when they use these phone services to call people up at home to try and obviously get money out of them? What should people be alerted to?
I mean, people should be alerted whenever somebody is calling and, let's say, telling any story in regards, for instance, to relatives. So we have, for instance, this new form of telephone fraud, which as a phenomena is not completely new. We know the phenomena in the past where specifically elderly people were targeted. Now people are receiving telephone calls from somebody who is pretending that they are hospital officials. The story is a relative has fallen sick, needs money for medical treatment, and they try to encourage people to provide their money to ensure medical treatment. Or a kind of new ways of phishing where you receive a call from a so-called health authority and they try to encourage you to share payment details or to open an attachment to spread malware. Or investments are offered, something that is interesting in terms of curing or detecting COVID-19, and people are encouraged to make investments